also needs to do the needful. We too also need to read before
Labels.
you buy that. Yes, before you buy that product, read it. But some would also say those products are very, very written. They are written in tiny fonts.
You can barely read them.
You can, absolutely. So would you also be advocating that government, is there a way to push these manufacturers to make these warnings as bold as possible?
Manufacturers do the needful.
Absolutely. So we have to give the manufacturers are in it for one thing, just money.
Profit.
It's just profit. And they realize that the sodium allows their product to last longer on the shelf. The longer it lasts, the more they can reach to people. So that's where we need the government enforcement agencies. Just like the way they're going aggressively about drugs, they can do the same thing. Because salt is really killing us. So we have to be mindful. So there could be random checks. And once you're fined, then they can actually ban you. But our concern is actually larger than that, because majority of our people eat from Mama Put. Mama Put doesn't have any labeled food.
Okay, that's another point.
Honestly, so we have to, we need educated consumers. We have to be, because we are what we eat.
So should we be looking at shutting down some of these Mama Puts, and, how do we even enforce these laws with some of these persons who are seemingly not even educated as it is?
Yes,
don't care.
We did some medical mission and we were telling people don't do salt, and the woman started crying that everything she does in her life involves salt. Because we are culturally bounded to it. So what we're doing is awareness to say, look, we need to start cutting down on this, because it does have all these little effects. It's been proven. We don't need, the research is out there. It's related to cardiovascular. The more you consume, the more cardiovascular issues you're going to face.
Well, so are we now saying that low sodium intake is the solution to any issues that has to do with cardiovascular health as it is? Because in my research, there were talks about controversies surrounding if low intake of salt or sodium is really the solution.
Absolutely. So there is no one answer that fits up. But what we know is at the cellular level, if we cut out sodium, the likes of silent killer high blood pressure goes down. We know that. So if I can make your diet to be out of salt, I can assure you that 10 to 15 millimeters of your blood pressure will drop. So if I can make you not to be hypertensive, I can reverse your risk of getting stroke. Your risk of diabetes goes down. And then we need other things. We're not moving. We are one of those generations where we're just sedentary. Sitting becomes the new smoking. So that tells us it's bad. If you don't move, your blood doesn't move. When blood doesn't move, it clots. So those are the other 5 and 6 of cardiovascular issues. We have other things. We're sleep deprived. We're not sleeping.
Yeah, we wake up too early.
We wake up too early, we have insomnia, sleep too late, and so our quality of sleep is gone. Our quantity of sleep, we cannot even talk about it.
Okay, and making these necessary changes, lifestyle changes can be very challenging.
Right.
So how do you beat that? Some say, okay, don't be too hard on yourself. Just do a gradual reduction in salt in the context of our conversation. But how do you beat the difficult nature of cutting down or making the needed changes to save your health?
So we have to look at what's the bigger picture. So everybody, is the beginning of the year, people come up with new goals, and it's difficult to, New Year resolution, and it's difficult to stick to it. But you don't want to bite more than you can chew, or chew more than you. So take it one step at a time. If your goal is this year, I want to lose a little bit of weight, what are the measures to go about that?
Salt number one.
Salt number one. You can cut that out. What about your sleep? Don't go to your bedroom with a cell phone. Make sure your bedroom doesn't have the TV on. These are things that you can do on your own level. You don't even need government in that area. These are things within your control. How much water are you drinking? We see a lot of people, they come to the clinic, their urine is always colored and it's never a bother to them. Their urine forms is never a bother to them. That tells me they're dehydrated. Their blood pressure is about to go up.
But then you see people say, okay, I can't help this. So let me just stick with my drinking as much water as I can, because the kind of work I do, maybe I eat out a lot. I don't have a choice. I don't know. I cannot cook at home. So, or maybe I take herbal whatever to flush out the toxins in the system.
Detoxify.
Right?
So surrounding that are a bunch of myths, and we need to face it. Just like people will tell you, oh, I cannot get enough sleep during the week, I'm going to make it up on weekend. It's never possible. The body doesn't function on that. So again, if you know that you cannot help it, you have to eat a lot of Mama Put, then start walking more. We don't walk. If you walk more, you actually will be able to sweat some of this out. So there are things we can do to mitigate this, but we know the ultimate goal is reduce salt consumption.
So how about those who say they use seasonings, but they don't add salt into their meals? Is that also another way?
Yeah, that's also another way, because you be mindful of which seasoning you are using. Some of these seasonings also have sodium in it, but you can be educated about it and look at what you're putting. But you have other options: the ginger, the garlic, the crayfish, the cloves.
Locust beans.
Locust beans. These are what our grandparents used to use, and they were, as far as we know, mostly organic. So the more you can do that, you start switching. And again, you have only 7 days. Your taste buds will forget about it.
7 days and counting. But then there's also the aspect of some salt. I'm coming back to this matter where you say it has vitamin this and that, and so all those do not even count.
Absolutely.
Really?
Because once you look at the label and you see the word sodium, that should be a poisoning. You want to stay away from it. Because we know, the research is abundantly clear. We know, especially for black people. The study came out now, we're talking about this because they actually related it to white people and to people with normal blood pressure. That salt consumption is now a risk factor for cardiovascular issues. And what it does to your blood vessel and my blood vessel is oxidation. So that's like when you put a metal outside and moisture gets on it, it rusts. That metal becomes rusty and it gets weakened. The same thing is the effect of salt to your blood vessel and my blood vessel. And that's how it leads to stroke. That's how it leads to heart attack.
So then what are the symptoms then of persons, I think we need to talk about this, who perhaps are now at the verge of a cardiovascular disease or heart attack? What are the signs they should see and know that, we know what, I need to start working on addressing this matter?
Absolutely fantastic question. So for men in my clinic, we see the men coming in, they're having swollen ankle. The ankles were not swollen before. That tells them that the heart is struggling. It's struggling because there's too much water. Where is that water coming from? The salt you're eating. A man that was not known to be snoring all of a sudden starts snoring. His neck size, you normally buy your husband the shirt, is now gone up. It's now 17 and above. Those are signs of cardiovascular. He used to be able to walk with his kids. Now when he pick up the kids, he's having difficulty breathing. In the bedroom, he's not able to perform. That's the erectile dysfunction. We see it. He's not able to have that. Or newly married young man is not able to get the woman pregnant. Those are signs and symptoms of cardiovascular issues. And so it needs to be.
That's for men.
That's for men.
That's for me.
For women.
Is it
Let's balance it.
It's almost the same. Women will also have increase in their hip size, and they will know, because we expect some women that are pregnant to have swollen feet. We know, and that's because of retention. The baby is developing. Baby will push on the blood vessels, but as soon as delivery is over, those are supposed to go away. If they don't go away, then you need to go back to your doctor. What's causing my pregnancy-induced hypertension? It might be the salt that you were eating. It's related. They're all connected.
And but then it's not over yet. Even with these signs, you also mentioned urine. The color of your urine is also a sign. Yes. Kidney stones. I don't know if kidney stones has a
blood clots and all of those.
Blood clot especially, or you find out that you're sitting for too long. And some men, even during the day, they just fall asleep. If you don't engage them, they start falling asleep. They're becoming insomniac and they're becoming narcoleptic. You go to pee in the morning, your urine is colored. You drink more water, it's still colored. That's a sign that cardiovascular issues is around the corner. You pee in the bowl and your urine foams up. It's not supposed to foam. Your urine is supposed to be like water. That's a sign.
And the way to go is basically...
Cut out the salt, increase your physical activity, walk some more, drink some more water, and wait for it, engage in good sex.
Now that's... Right. Okay. Now, there's a question I have to ask, because this matter of drinking water, I hear that for it to get to the organs, and you have to add salt for it to really get to the other organs, because there are those who drink loads of water, yet are still, they do not have as much in the system as it is, but until you add salt, then you can feel the impact on your organs. So how do we, so that it also cuts that off? Absolutely.
So what we recommend is not salt. That's a myth. What we recommend is anything that has electrolyte. So you can add lime, you can add lemon to your water. What that does is it gives you citrus in that water and allows you to get into your vein rather than you just pee it out. So yes, because some people will complain that they don't like the taste of water, they cannot drink it like that. Or so you can add like lemon or lime to it, or you can even put a little bit of honey just to sweeten it. That allows your water to get into your vein.
Okay,
And
electrolytes.
yes, electrolytes. And the way you know that you've drank enough is the color of your urine. Your urine needs to be clear, it cannot form bubbles. If you see any of those, you are dehydrated, and those are early signs of cardiovascular issues.
Right. But then, of course, as a way to balance this, ORT, for example,
Yes,
now,
yes.
using salt
Oral rehydration
and
therapy,
all
yes.
of that. Is that still the way to go?
Yeah, that's still the way to go. The reason we give ORT, especially in kids who have had diarrhea and we know that their blood pressure is dropping, then we give them oral rehydration because we need to save you before we actually know what's going on. We cannot lose you and be saying, oh, this is probably what happened. So ORT does work. But when we're talking about adults and you have control over what you eat, you need to cut out the salt.
Importantly, have control over what you eat. That's quite difficult in the right now when you look at the economic situation, because getting ginger, getting all those cloves and all of that, it's quite a tough one. But all in all, your final admonition to Nigerians, and then especially to parents, how they can, just save their kids from all of these issues at the end of the day. Because we are seeing children having cardiovascular issues,
Absolutely.
being obese and all of that. So how do we then begin to balance meals moving forward, now that we know salt is a danger?
Excellent. Fantastic for parents. If you can minimize how much your kids eat outside, it's better because then you take control back. Once you take control back, that you restrict them from eating outside. So maybe even if it's dinner that you guys eat as family, you can control how much sodium is in that dinner. Increase their physical activity. Michelle Obama launched the 1 hour a day. There is benefit to that because we're not moving. If you're not moving, sedentary lifestyle leads to cardiovascular issues. And the earlier you get your kids involved, the better. Make sure your kids go to bed early. Let them to get good sleep. If they're not sleeping early, we see young boys.
How early is early?
So depending on their age, we recommend 8 p.m. and let them sleep till 4, 5 in the morning. The more sleep they get, the better. That is the only time the brain can recalibrate. If they're sleeping against the circadian rhythm, they're going to develop high blood pressure. They've done that. We looked at this
for a child.
Even for a child. We looked at this in the US. People who work night shift, all of them develop cardiovascular issues. Doctors, nurses, everybody that work night shift.
How about those who work morning shift, early morning shift?
So, cardiovascular,
right?
especially for us in this part of the world, cardiovascular is a big one. We are not inundated with infection. We do get them, but the highlights of silent killers, high blood pressure, diabetes, stroke, metabolic syndrome, it's all linked to what we eat. So it's better, the sooner we eat our food as medicine, if not, we're going to eat medicine as food.
As food, right?
Yeah, I now recall that you mentioned something about organic food, but there's also, we are seeing other kinds of food items as it is that are not necessarily organic. Do they also pose a danger?
Absolutely, because you want to be mindful of what they put in those food, and the more fiber you can get. Fiber was what they extracted away from organic that becomes all this process. The more fiber you can get, the better for you, because you need your GI system to work well. So there will be less stress on your cardiovascular system.
Right.
So much has been said, so much to unpack from this conversation, but we must thank you, Dr. Rashid Abbasi, medical consultant and chief medical director, Heritage Men's Clinic, for your time on the program.
Thank you.
And the education. Thank you.
All right, still ahead on TT Breakfast. The new world record is set to be broken by Nigerian-born media professional